When you were a child, and your mom would kiss your bruised knee saying it'll make it better, she knew what she was doing. The placebo effect is an amazing thing that relieves a person from pain or other symptoms of the disease without the help of real medicine. It is believed to be an autosuggestion, but how can one be cured with the thought alone? And what is placebo effect really like? This term has come into use around the 17th century. It comes from the Latin word placebo, I shall please. Even then the doctors were giving sugar pills to terminally ill people so that they wouldn't lose hope. But the active study of this phenomenon began relatively recently. During the Second World War, an American anesthesiologist discovered that a saline solution, basically water with salt, had an analgesic effect on the wounded, and wrote an article, The Powerful Placebo. Some researchers believe that the whole history of medicine comes from the history of placebo affecting people, which is capable of reversing a curse. Homeopaths and other adherents of alternative medicine, they all exist due to the amazing human ability of self-healing. A recent survey showed that in Bavaria 88% of doctors still prescribe placebo to patients mostly for nervous or gastric diseases, or in cases where nothing else worked. In the UK a pure placebo is prescribed by 12% of doctors, and in Chicago about 20%. Psychiatrists resort to placebo the most. About half of them tried to cure people with the help of placebo. But how can you be cured without resorting to the real help of doctors and medication? Placebo typically eliminates the symptoms only, not the disease itself. But with Parkinson's disease this was not the case. It is believed that Parkinson's is associated with a lack of dopamine, a super important neurotransmitter in the brain, and placebo actually increases dopamine levels in patients. With the placebo effect, the same parts of the brain that would be affected by a real medication are activated. If you replace painkillers with a sugar pill, the brain starts actively producing endorphins, a natural painkiller. But it does not work the same for everyone. It depends on the patient's personality, their attitude to the doctor and medicine in general. Hypochondriacal extroverts are much more susceptible to this effect than distrustful introverts. But even if the patient is so gullible that they can be cured with the help of a mother's kiss, this isn't always good. Placebo has a less known twin brother, nocebo. The effect is the same, but negative. If a doctor, for example, warns a person that after taking a pill, they may develop a rash, it's very likely that they actually will, even if the pill does not contain any active ingredients. That's also why you shouldn't get carried away with reading about the side effects. Pharmacologists are quite cunning. They often use placebo effect for marketing purposes. For example, it's been proven that large pills are more effective than the small ones due to the placebo effect, that yellow pills are better for depression, white ones for stomach ulcers, and blue ones for insomnia. And it turns out that we believe that the expensive medications are more effective. This was proved in the experiment. Two groups of people who had been slightly electrocuted were given the same sugar pill, but one group was told that the medicine cost 10 cents while others believed that they've taken a pill for $2.50. And in the group that took expensive pills, a larger number of subjects noted improvement. Strangely enough, a placebo effect can happen to those who know that they were given a decoy medicine and not a real one. In this case, the belief in the placebo effect leads to the appearance of the effect itself. That's the power of suggestion and autosuggestion. But recent studies show that even animals can experience something similar to the placebo effect. Epileptic dogs or hamsters, if you artificially create winter conditions. And they can hardly be deceived like that. But the most astonishing was an experiment in which people in pain were shown photos of other people that either writhed in agony, or only looked slightly dissatisfied. The level of pain induced did not change, but people reacted to it differently, depending on the picture shown at the moment. Even when these photos were shown so quickly that the human brain could not process them, the subjects still said that it hurt them more, while a picture of a person suffering terribly flashed on the screen. 12 milliseconds, yet the placebo effect still works. This proves that placebo and nocebo occur automatically, detouring consciousness. The placebo effect is still being actively studied. There's one thing for sure. Any bauble of folly will keep the baby jolly.